Hello everyone, it is August the 26th and I thought I would come to you guys and offer you a brief update, 3 to 5 minutes, won't take much of your time. If you're not interested in an update regarding COVID, then you don't have to watch the video. That's the beauty of the play button. You can always do the opposite and unplay, right? So with the COVID testing, we actually, as told the community, we signed a contract with Blue Water DX, which is a lab out of I think out near Louisville, but they have taken care of our testing. So basically we carried testing as long as we could, but we've seen demand go up. We've seen people need tests on weekends. We've seen the lines grow longer, and we just no longer have the capability to do it here with our staff. So we want the community to have their needs met. So we signed a contract with them. We got them down here. They're now testing over at Fireman's Memorial Park, Monday through Saturday, 9 a.m. to 4 p.m. Central Time, and Sunday, there's actually a Sunday test time frame now, from 12 until 4 p.m. So we're no longer doing testing. If you have any testing or questions, if you need your testing results, all that needs to go through that company. Now, it's my understanding that they contact people, they send out text messages. They've requested that you give them 48 hours before you even contact them. So when you test, wait 48 hours from that time before if you haven't received any results, before you start asking, where those results are. For convenience, because again, we're not doing testing here, but when you call the health department, 270-259-3141, if you select option 1, that'll automatically connect you to Blue Water, so you can ask questions or whatever have you if you haven't got those test results in that time frame. So if you don't have to write down the number, just call us here and press 1 and it'll automatically get you connected. Got an email from the hospital yesterday, and I wanted to give them time to do their press release. But it looks like, as of right now, they have 16 unvaccinated people in their care, in what I call general care, and 1 vaccinated person, and in critical care, 5 of which are unvaccinated, and 5 of which are unvaccinated, and 1 of which is vaccinated. So total 2 people who are vaccinated. So again, well above the majority of these people are unvaccinated people, which just goes to show you the strength of the vaccine. There are breakthrough cases. There are going to be breakthrough cases with the Delta variant because the viral loads are so high. But overall, the vaccine is still proven to be effective, and it's probably it is the strongest tool we have to fight against this virus. So today we're actually doing COVID shots over at the public library. They're going to be over there from 9 until 11. So right now it's 10:46. They're fixing to close up their morning session. They'll come back and they will give shots again from 1 until 3. So what shots can you get? We got the Pfizer. We did Pfizer in stock. We have Moderna in stock, and we have the one shot Johnson & Johnson. Yes, we are doing that third additional dose. So some people call that a booster. Some people don't like us calling it that just yet. So I say additional. So if you need to get the third additional dose because you're immunocompromised, you can come today. They're doing those shots as well. Again, at the library here in Grayson County. Fixing to close up at 11, but they'll be back from 1 till 3. You do have to wear a mask in there, and they're trying to separate people out as best they can. So let's talk a little bit about the COVID numbers. As far as those testing positive, it is through the roof. There's no other way to say it. We are seeing mass spread. Over 400 people actively ill with the virus. This is the most we've ever had. And so this is worse than 2020. And so why is it? People say, well, you got the vaccine's not working. Well, the problem is not enough people have been vaccinated. And those who are not getting vaccinated, first of all, it is a personal decision, all right? I have friends who are unvaccinated. I have family members who are unvaccinated. And I understand that they feel like they have the right to do that. However, it is causing the virus to be able to mutate because as it spreads more, the virus gets smarter, can mutate, becomes something a little bit different each time. So of course the vaccines are not going to be as highly effective as they were just a few months ago, but they're still offering protection. And so if you have not got your vaccine, please reach out to your primary care doctor. Don't get your information off social media. You know what? If you don't want to trust my word, that's fine as well. As long as you'll talk to your primary care provider and get his or her understanding of it or their recommendation, then I'm perfectly fine with that. I respect physicians and medical providers a lot, and I think we all should. So with that being said, that's kind of where we are right now as a county. Spread is very, very bad. I actually posted a couple days ago a request, and I asked the community members. It's not a requirement. I don't have the authority to require that, but I asked you, wear a mask. If you're going to worship, I go to church as well. Make sure that you're separating out. Wear a mask if you can, and just take good common sense steps to try to reduce the risk. If you're more comfortable and your church offers streaming, so you don't even have to go, you can stream it at home. It's probably not a bad idea right now to be streaming services versus going, so you're not all huddled up in one space for a long period of time. Again, the viral load with the Delta variant is higher. It's more contagious, and so it spreads it more easily. So that's where we're at. I also asked people, if you're going to have a party, a gathering, do it outside, limit numbers, and if you're sick, get tested. If you've been exposed, get tested. And if you're sick, stay home. That's like the most respectful thing you can do. We do it for the flu, we should. We should do it for anything that's contagious, and we definitely need to do it for COVID. And really quickly, let me talk about contact tracing, where we're at. We just do not have enough contact tracers to be calling every single person that's actively sick. That's just where we're at. Is that ideal? No, it's not. We don't like being there, and it's stressing the tracers out because they want to be able to reach every single person they can, but they can't. So here's the thing. If you've tested positive recently and you have not been contacted by the health department, please reach out to us. Let us know, 270-259-3141. And reports, and we're calling it self-report, okay? Let us know so we can at least offer you some instructions and some clarity as to what you need to do going forward. So as always, I'll end this by saying if you need us, we're here, 270-259-3141. And we also have a website, graysonhealthcenter.org. Everybody, please stay well.